welcome again to the channel. Today I want to talk to you about a practical odontological mistake and why it is important. It's called food impaction, and sometimes when you have a hole between your teeth you have to go down from the top. I have illustrated this by some balls. You have to go down here, that will be the top of the tooth where you're chewing your food. And you have to go down here and drill and come down between your teeth. Now when you do that, there's a risk that when you've made a filling, you see when two natural teeth have a contact point, just like this, and that is highly important. When you make a filling sometimes, or a crown or whatever, any kind of restoration, there's a risk that this contact point is not obtained. And you have, as you see, a funnel, meaning that food can come down here between the two teeth and go further down under the gums, and it becomes very difficult to clean this area. I've seen this sometimes when you have natural teeth, no fillings, no restoration whatsoever, and you see this. I don't know if it's, there you go, maybe I should look down. And you see that there's this little gap between two neighboring teeth. Again, up here you chew your food. My fingers are where the roots will be. And that doesn't seem to constitute a problem at all if it's natural teeth, that it's made this way naturally. So nature kind of prevails. But if you have this restoration made, this filling or this crown or whatever, and there's a gap, you have food impaction, meaning that typical chewing gum and meat fibers will come down between your teeth and be difficult to remove again. Sometimes it goes much further down here and causes problem with the gums and this whole connection between the teeth and the bone. And also you have often, if you again pretend this is a tooth, and you will have caries, defects, cavities down here. And they kind of tend to grow on the roots, downwards, and it becomes, when it finally is discovered, it becomes very difficult to fix that again. And more often than not, it ends up in a bad root canal filling, a bad filling altogether, because the tooth is too destroyed, and you don't see this unless you take X-rays most of the time. And it's moving very fast. That's why I address this problem, because I've seen it. Normally you have some time, you can, things don't develop that fast in your mouth when it comes to decay, normally. But in this case, even a normal person can have a very rapid expanding process that will destroy the tooth completely. You hardly feel anything most of the time, except for maybe people say that, I just clean it up and it's fine. And I even hear dentists that say that, well, you just need to be better with your toothpicks. Let me put it to you this way. If there is food impaction, the treatment is without value. That is, you have a bit of a responsibility yourself, because maybe the destruction in the tooth is so large that you must put on a crown. And if you say to your dentist, I don't want to spend that kind of money, then you assume responsibility for this, because he has informed you, and But I also hear this a lot, unfortunately, that people come from the dentist, and the dentist they tell me that the dentist has said that they should just be better at using dental floss, and they spend a lot of time showing them how to clean this up. But it's impossible, because you go all the way down, further down, mid root actually, and there's your destruction. What you will possibly feel yourself is your gums will be bleeding locally. So if your gums are generally not bleeding, and I hope they are not, then they will be bleeding from that point. There will be a bit of soreness. There will be, when you use your toothpick, there will be a bad taste, a bad smell from that particular area. And I often tell people that you can take your toothpick and have your fingers draw the toothpick between your fingers and then smell your fingers. It doesn't sound very pleasant, but it's a good way to diagnose this, that you are not, you have the wrong kind of bacteria between your teeth. You should demand from your dentist that there is no food impaction. And unfortunately, I see a lot of people that try to, when I make a filling, I say, if it's between the teeth, or a crown, I say, now you go home and you eat some chewing gum, and if anything gets stuck between your teeth, you need to come back. That's all I can do. If people insist on, no, but I can fix it, I can do it myself, I can clean up and whatever, then, they're not following my advice and they assume responsibility. So as a dentist, you must inform people that there's a risk, that you can take the dental floss and you can feel that there's resistance in the next gap between two teeth, and then boom, there's suddenly no resistance. That means you don't have this point that I just showed you about, that there is a very hard or relatively hard contact between two neighboring teeth, and there will be some resistance when you use your dental floss that has to pass this area here. So it's very important. And as I say, if your dentist tells you to spend a lot of time trying to instruct you how to clean this area, you should probably connect to a second opinion dentist and possibly find another one. Or say to that dentist that he should use a different kind of technique so that there won't be. It is actually possible, even with plastic fillings, to make a good contact point to a neighboring tooth. However, if the destruction is big and the distance between the two neighboring teeth are big, it's difficult to build out, and if you build out the plastic for this contact point to reach each other, there will be some unfounded plastic pretty much hanging into thin air, and there's a big risk that the tooth the filling will break down, which is not the worst that can happen. The worst that happens is the tooth breaks down. Especially if you spent a lot of money and you've gone the whole way and you made a crown on the tooth, then you should absolutely demand that there is no food impaction. And it doesn't hurt a lot, it doesn't give you a lot of very clear symptoms, but it is worth noticing every time you had something done with your teeth. And people they say, when they say to me, but I don't know, it's probably okay, it's not so bad or whatever. Then I ask them, what about the other side? That's fine, they say, indicating that it's not fine in the first side. And sometimes you have to use these tricks to get people out of the forest and into the open and say, okay, it's not that good. And then, because they don't want to have this remade, because making teeth is not a pleasant pastime, is it now? But the problem will increase, and there's a relatively large chance that you may lose the tooth altogether, and then you might say, well, we can just have an implant. And a lot of people that make implants, they have the same attitude, but nothing compares to nature. Remember what I said in the beginning, if you have a natural situation where you don't have this contact point, there is no problems. I don't know, my theory is that, well, the teeth are placed exactly in the position and by the way they meet the upper jaw, and they're fixed into place, and kind of, it's nature just have a wonderful capacity to just make things work. And then we come along, and I always say, all I do as a dentist is I imitate nature as good as I can. But it's a damn big task, I can tell you that much. So that was about food impaction. I hope that a lot of you, if you have food impaction, will go to the dentist and get it fixed, because it is one of the things that, even if you are good at cleaning your teeth and you have a good oral health, it is one of the things that can make you lose a tooth and completely break down. And sometimes you get pain before that happens, but most of the time actually you can have enormous cavities without even having felt anything about it. Typically people come to me and they say, there's a little piece of my tooth that's broken off, and then half the tooth is actually gone. So, get yourself to the dentist. So, that was about food impaction, a practical thing. And as I say, I hope you don't have this problem, but cleaning it is not the solution. You have to have it fixed by a dentist. So, like, subscribe, and come to the second opinion dentist if you have anything you are in doubt about that relates to teeth. I can evaluate and I'm not biased. Thank you. Goodbye. See you soon.